Welcome back in. Well, a lot of us will be outside over the next few days, and it's heating up out there. Toledo Clinic Dr. Lisa Graves Austin joins us this afternoon with some things to keep in mind so you could be safe this time of year. Thanks for being here today.
Thank you for having me.
You know, we were just chatting a little bit. We experienced that really hot week a couple weeks ago, and it does seem like it's getting hotter out there, and we're seeing the effects of that, aren't we?
Absolutely. In fact, some data from the CDC recently showed that the number of heat-related deaths has increased from 720 in 2018 all the way to 2,300 heat-related deaths last year. So that's almost a triple increase.
Wow. Okay, so we really need to be paying attention because, you know, if you've lived here for a long time, you just might think, well, it's summertime, but, you know,
Right.
things are heating up. So we know we're supposed to drink water.
Correct.
What else are we supposed to do?
Well, in general, you know, be mindful of your body. Not just water, but electrolytes as well. Fruit can be a great source of that. Gatorade is something else you can drink. Be mindful not to drink a lot of carbonated beverages and things with sugar because that can actually dehydrate you. So being very mindful of that as well.
Okay, that Gatorade, you know, if you're sweating a lot, you know, especially if you're outside, you know, or exercising, things like that. And let's talk about the time of day. What we need to be aware of at what time during the day.
Absolutely, a very important safety. When it's a heat index over 80, 85, especially for our older individuals, go out early in the morning, okay, before the heat really comes on. If you're going outside to do yard work, take water with you. It is so important to have the water with you. Also, keep your cell phone on you, or if you have a assist device button, something like that, especially for our older individuals, it's so important to keep that with you because so many people fall outside and they don't have a way to call to get help. Make sure if you're going to go outside, even if you're a younger person, tell somebody, hey, I'm going to be outside in the yard. You know, just let somebody know you're going to be there for safety in case something happens.
And if we can, I would imagine we can maybe change our routine a little bit, do things different times of day than we normally do.
Absolutely. Get up early in the morning, crack of dawn to do your yard, any weeding, anything you need to get done, but definitely try to do it not in the heat of the day.
Okay, so let's talk a little bit about what could happen when we get too hot. So where does it start and how does it progress?
Absolutely. There's two main disorders, one called heat exhaustion and the other heat stroke. Heat exhaustion is what most of us think of when we're overheated. You're going to feel sweaty. Your body's trying to cool itself down. So you may actually feel cool to the touch. If someone has heat exhaustion, you're going to touch them, they're going to feel sweaty.
Okay.
And they may actually feel cool. Well, then your body's doing its job. Okay. They may feel nauseous. They may feel dizzy. They may feel lightheaded. The time then is to hydrate, cool down immediately, because if you don't, then it progresses to something called heat stroke. Okay. Now that's a whole different avenue. That's when your body temperature has exceeded 104 degrees, 40 degrees Celsius otherwise. And at that point, when you reach that degree of heat in your body, you start to get brain damage, muscle breakdown, heart breakdown. Patients can go into a coma and die. You can have a true stroke because of brain swelling. At that point, people will be confused. They may actually be unresponsive and can't drink water at that point. So if someone's acting that way, they're going to feel dry. They're going to be hot. Okay. At that point, call 911. Grab every ice bucket you can find. Grab a garden hose. Anything to start cooling their body temperature down, because otherwise it can be fatal.
Right. So we definitely want to be careful about this. And I think, you know, we've got this holiday coming up tomorrow.
Absolutely.
A lot of people are going to be outside. And we know today was 90, you know, warm today. Going to be warm heading into the weekend. So what are something that you want folks to remember as we try to celebrate this holiday safely?
Absolutely. Number one, stay hydrated. Keep water around, non-caffeinated beverages. It's so important. Water safety, you know, keep an eye on the kiddies. Keep an eye on your skin. Very important. Don't forget to use sunscreen. Watch your alcohol intake. People don't realize that beer doesn't necessarily hydrate you, and you can actually get dehydrated. So water is very important. And of course, fireworks safety, which I believe you're going to be talking about that as well. Common sense safety.
And speaking of alcohol and fireworks, Not a good combo.
Absolutely not.
So just be smart about that. And we know that those sparklers, they get really hot. It's when those kids, they're holding them, and they can cause a lot of damage.
Absolutely. And even after you discard them, make sure you dispose of them, because the little ones, those sticks remain hot for quite some time, the metal. So definitely keep them out of kids' hands.
Maybe leave it up to the professionals. They do a good job, don't they?
Absolutely.
All right. And if people may not be super familiar with the Toledo Clinic, you've got locations all over the place, right?
Absolutely.
And people can get in touch. There's the phone number and the website so that you can get in touch, maybe schedule an appointment if you got something you've been putting off, right? I feel like we always do, right? Thank you so much for being here today.
Thank you.